Infertility is defined as the inability to become pregnant after a year of regular unprotected intercourse and can be caused by several factors such as male infertility, ovulation disorders, and exposure to toxins. Conventional medical treatments for infertility come with side effects and high costs, and phytomedicine has been used as an alternative, due to its low cost and lack of side effects. One plant species, Withania somnifera, commonly called Ashwagandha, has been studied for its potential to improve infertility and sexual distress in both men and women. It is believed to enhance steroidal hormones and improve fertility due to its antioxidant properties. Clinical studies have shown the efficacy of Withania somnifera in increasing sperm count, volume, and motility. Previous studies have shown that Withania somnifera, a plant, improves sexual distress and increases steroidal hormones in both males and females, stimulates gonadotropin hormones in rats, and improves human menopausal syndrome. Its antioxidant properties have been shown to inhibit oxidative stress in sperm, leading to its validated aphrodisiac, spermatogenic, and fertility effects in humans and animals, as supported by both open literature and patents. Withania somnifera extracts have been studied for their potential in treating oligospermia and improving libido in both humans and animals. Clinical investigations have been carried out, including a pilot study on male patients with oligospermia, which showed positive results on semen parameters and serum hormone levels after a 12-week treatment with a standardized capsule of Withania somnifera root extract. A study administered 225 mg of Withania somnifera root extract orally to 21 patients 3 times daily for 90 days and compared with 25 patients on placebo. The results showed a significant increase in sperm count, semen volume and sperm motility by 167%, 53% and 57%, respectively. Another study compared Withania somnifera to pentoxifylline in 100 infertile male patients and found that Withania somnifera improved sperm parameters without adverse effects. Withania somnifera is believed to improve infertility by suppressing oxidative stress. However, ashwagandha is commonly consumed as a supplement in the form of capsules or powder, mixed into teas or smoothies, or added to food. The recommended dosage can vary, but a typical dose is 500 to 1000 mg taken daily. It's also important to note that Withania somnifera should not be used as a substitute for conventional medical treatments and that patients should consult a licensed healthcare provider before using it. Infertility is defined as the inability to become pregnant after a year of regular unprotected intercourse and can be caused by several factors such as male infertility,